Hello, good afternoon. This is Dr. Stephen Evans from Outlook Magazine. Today we're most excited to talk to Dr. Ferdinand Cabrera, MD, founder and president of Genesis Health Institute here in Wilton Manors, Florida. Dr. Ferdinand, welcome to the program. Thank you so much. You're right here in Wilton Manors. You've been a long-term supporter of the magazine. Tell us about what's going on at Genesis Health Institute.
Okay, well, first and foremost, thank you for having me and allowing me to reach out to your readers and to your subscribers via the internet. We at Genesis, we've been established for over 15 years, and we believe that adding life to your years and years to your life. So basically, using retuning the body biochemistry and looking what is missing in your body as we start aging, restoring that balance is what allows us to continue providing excellent health care, preventing age-related diseases, and also providing excellent health and vitality to all of our patients.
You've been in business 20 years here, I believe. Is that true?
I have been in Florida. I've been a physician for a long time, and I don't know how long because I'm going to tell you my age. But in Florida, I moved in 2004 with the intention of doing this type of practice. I identified that it was a need in the medical community, and also at the time we were start seeing the research that was becoming about doing bioidentical hormonal therapy and restoring natural homeostasis in the body, utilizing just nutrition and antioxidants.
Okay. If you want to tell us about some of the services and some of the treatments that you all provide. I know there's a wide range of treatments, but what are some of those that you provide?
Yes. Well, starting with prevention. Prevention is something that is crucial. And in an aging population, talking about baby movers, patients between 55 and 70, what we see the prevalence is heart disease, hypertension, diabetes, obesity. So by looking for the specific markers in the blood work, I am able to identify those markers that produce inflammation, that trigger the patients to develop diabetes, that will produce uncontrolled hypertension, and also that will continue the patient to be obese. So identifying those are crucial. And that's what I call the metabolic aspect part of the clinic. And obviously, once the patients start getting to their ideal body weight, we restore their energy, the sex drive, and they want to look better. So using the aesthetic aspect of the clinic, I'm able to improve the fine lines and wrinkles. Everybody between 50 and 60 has lost a little bit of facial volume. That's why we have a wide variety of dermal fillers that are intended to restore the original volume that the patient used to have in the years that was 30 or 40s. And also the skin. So Florida, as you know, the sun is one of our attributes or one of the things that people move here. But in the summer, it's extremely strong. And we are exposed to intense UVB or UVA skin damage. That's why we have laser treatments that treat and prevent the dark spot and aging skin. Also, in the skin area and volumization, we have the Ulthera, which is the non-invasive facelift, which the target is to produce collagen in the deep dermal layers of the skin and give you that full volumized appearance. Also, at the level of the aesthetics, we have body contour, and we provide that with a sculpture, and that basically allows us to contour the body without invasive liposuction. And besides all that, in the metabolic aspect also, we have intravenous nutrients, which are targeted for patients with chronic autoimmune disorders, increasing the antioxidants, removing inflammation, Also, we give the IVs in patients that are looking for an athletic edge in energy, patients that want to recover from surgery, patients that want to recover from COVID, not to recover, let me be clear, but patients that are having a hard time recovering from the disease that need a little bit of a boost, that can be accomplished also with the intravenous nutrients that we provide.
So there's all kinds of services that you provide. I know the laser treatment is one that's very popular. The IV nutritional therapy is also one that's very popular that I know people have come to see you a lot for. If you want to maybe tell us a little bit about that too.
Yes, well, the intravenous nutrients are essential as we age. Unfortunately, the absorption at the level of the small intestine decreases. We produce less acid, we produce less enzymes. So, in order for me to reestablish the homeostasis and the balance, we remove the offending agent from the diet, but also we allow that intestine, that small intestine, to recover, providing the intravenous nutrients. The mix contains high dose vitamin C, between 25,000 units of vitamin C and 50,000, calcium, magnesium, B12, B complex, folic acid, and multiminerals. That is the ideal mix for me to start treating the patients, and ideally, those are given weekly for a period of 10, 15 weeks. Then I measure the nutrients in blood and urine and establish what is working and if the patients require further treatment or a different mix of nutrients.
Okay. Are there certain signs people should look for if they come to come see you for those?
Yes, absolutely. Somebody that feels severe fatigue, patients that are losing weight without any explainable reason, patients that are having chronic diarrhea, patients that have loose bowel movements, patients that every time they feel they eat, they feel loaded, distended, gassy. Those are minimal signs of malabsorption, and those are the patients that are the best candidates initially for the intravenous nutrient therapy.
So there are certain signs, and a lot of them they help you feel better, they give you more energy and better health and longevity for many of your treatments.
Absolutely. Well, absolutely. In essence, when we decrease oxidation, that is a medical term, but if we decrease the oxidation at the level of the cell, we improve the quality of the skin, and we allowed all the cells that the body continues to make all the time. Those cells will have a better quality, better morphology, a better DNA. So, of course, it's going to translate in the quality of your life, in the energy, in all your other metabolic functions.
And then tell me a little more about the facial fillers and some of the laser therapies. I'm interested in that. I know I've had people come and had success with those. If you want to tell me maybe a little more about those as well.
Yes, for me, it's crucial that the patient looks natural. So I assess the patient anatomy. I discuss with the patient what their volume loss, where the volume loss is located, and then we have a wide variety of fillers. From the fillers that contain hyaluronic acid, and these basically are the Restylane, Belotero, Ovela, Voluma, the Allergan, and also Versa from other fillers. And the advantage of the hyaluronic acid fillers are these fillers are very flexible. There are different levels of thickness of the gel, and also there can be removed in case of an undesired result. They're very flexible. The longevity of them varies. The higher the quality of the gel, or what we call G prime, the longer the filler will last. And it can be, some of them have FDA indication for specific areas, like the mid-face of the cheekbones, the nasolabial folds. And now the new hyaluronic acid that is coming from Restylane is called Restylane Kiss. And this is basically directed to apply in the lips.
Okay.
And we have other type of fillers if we want fillers that have a longer lasting effect. And there are several ones. We have Sculptra, which is polylactic acid. It's not
Okay.
a filler. Sculptra is basically produce collagen. So it's intended for patients that want a longer effect of the filler, but at the same time, the effect is going to be very gradual
Mm.
because we will see the full effect 8 weeks after injection.
Mm.
Another filler that is commonly used for long-term effects is called Radius. Radius is made from calcium hydroxyapatite and is injected very well in the mid-face nasolabial folds and also in the temple area. Also, we use Radius to delineate the jaw angle very successfully. This filler cannot be used under the eyes or the teardrop or in the lips.
Mm.
Another more longer lasting filler is called Belafil. Belafil is PMMA or polymethyl malic acid, methyl methacrylate acid, I should say, and bovine collagen. The Belafil has the capacity to last up to 5 years because it contains 80% of bovine collagen. Is we need to do a skin test. Once the skin test is applied and the patient is clearly that do not is not having a reaction to the collagen, then the patient is invited to get his procedure done. Belfield also has great results. It's also contraindicated in the area of under the eye or tear trough and in the lips, but it can be very well applied, it's very versatile to apply it in the mid-face, nasolabial fold, jaw contour, and in the temple area.
Mm.
So for me, the best way to do it is use a multifaceted approach. I usually use longer lasting fillers for the deep area and
Okay.
then use something more flexible in the surface to provide a smooth appearance. And for me, it's very important to assess the patient's facial dynamics and the way the patient moves, the smile. So it provides a patient that is enhanced but doesn't look artificial. And it's also very important for me to keep guys looking masculine and for the females to enhance their female qualities.
Mm.
And that's very crucial because my goal is somebody to come to the office and look the rest, but not impact anybody and find out what happened to you, what did you do.
Mm.
Nowadays, we are after the initial treatment with fillers and with celebrities that everybody used to look so done and so artificial. Now everybody's looking more natural, more relaxed, and that's what I always like to provide to my patients.
Mm. That was one of the questions I had, is that there's been so many advancements in all of these kinds of treatments. There's been so many improvements. What do you think are some of the major improvements that you've seen in these types of therapies that people are now have available?
I think what works for me is that I can combine doing the face, what is obvious, but I can use peptides to improve the skin.
Okay.
I can use peptides to improve body composition. I
Okay.
can use peptides for patients that want to improve or prevent hair loss, or patients that have had hair transplant that want to preserve the life of that implant or transplant. We can use peptides for that. So peptides are very well known nowadays. There's more and more research about them. And to give you an idea, peptides are just a sequence of amino acid. The chain are not more than 30. And the most common well-known peptide is insulin. So
Okay.
insulin has been in the market for a long, long time, and everybody knows what are the advantages of insulin. So these other peptides that are this time are being regulated by the FDA can be applied safely in our patients to achieve the desirable results. So the combination of peptides that improve the skin, plump the skin, in combination with the dermal fillers, a great reducer, plus a patient with a fantastic eating habits and exercise program, we will have the whole 360 in the way that the patients be taken care of.
Okay. And then when they come to you, you can advise them on all the different options and all the different programs that you have, because we've worked with you all for a long time, and I know you have a lot of different options for people, and you can give them really good guidance on what really are the best treatment programs based on their individual needs. And I know that you provide specialized and individualized treatment programs based on each person's needs. That's one thing I appreciate about what your office does for people.
Yes, absolutely. We offer to everybody that wants to come and have some detailed questions answered. We provide a free consultation for any type of question that the patient might have. And then we provide a plan. We recommended a plan, and then we start the patient according to what are their needs and their priorities. Yes, another program that we have here that is very successful is the sexual enhancement that we provide for men and for women. And basically is using the platelet-rich plasma. We use the patient blood, we put it in a special centrifuge, and then we harvest the growth factors that are in the platelets. Then serum is injected for the face. We call it the vampire facelift. And this provides a smooth appearance also to the skin. So we were talking about fillers, right? So I can put fillers in the patient, and then when the patient starts coming for good more fillers, I do a vampire facelift that increases collagen, promotes. If the filler makes collagen, like Radius, Sculptra, that will be a good add-on for the patients. And also, we use microneedling in the patient's skin to tighten the pores, to improve the complexion, dark spots. So that's very commonly used. In the sexual area, we use the same platelet-rich plasma, and we use it for men that are looking for a little bit of more sensation. They doesn't need to have erectile dysfunction. Some of them do. Some of them are diabetics and hypertensive, and they can take Viagra, Cialis, Levitra, but unfortunately, they don't have a good sexual experience overall. That's why using the platelet-rich plasma, we can achieve better results. And also we have the shockwave therapy, which in essence provide more blood flow, more circulation. And where there's oxygen, there's tissue growth. And where there's tissue growth, there's nerve sensation, and there's a better quality for the sexual experience.
So that's a wide range. The vampire facelift, I know that's been the topic with a lot of people, and you all provide that. That's an interesting topic. I've had the micro needling done at places, and that's I can attest that makes your face brighter and washes away blemishes. Is that the goal of the micro needling for someone who might not be familiar with that?
Yes, the goal of micro needling is to soften the skin texture and also tighten the pores and kind of exfoliate. A young skin is a skin that looks radiant, looks tight, and the complexion is very even. So that's one of the results that can be achieved using the microneedling.
And everyone, of course, is interested in the sexual enhancement packages that you were talking about. That's always a hot topic. So I know if you want to extrapolate a little more on that, give us a little more information on that. I think that was something very interesting.
Yes. So for the sexual enhancement, initially the patient comes and then fill a questionnaire that is very detailed. I consider a lot the patient's medical history, what medications the patients are taking. And some of the patients come here already in treatment with testosterone, because some of the patients are not aware that the erectile dysfunction might be secondary to testosterone deficiency. So what we use is we do the treatment, and then we provide because the patient already purchased the sexual enhancement package, we provide a free initial consultation to take a look at the metabolic aspect of the patient, what can be the other causes for the patient having erectile dysfunction. Then once we identify that, if the patient is in need of testosterone, we provide it. If the patient, definitely we will use the sexual enhancement package. And patients that have severe erectile dysfunction, then the shockwave therapy is offered as important part of the sexual enhancement package. That includes between 6 to 10 sessions of the wave therapy. It takes approximately maybe 15 minutes. It's totally painless. So we have to have the patients twice a week. And then we do an assessment 4 weeks after the treatment is finalized. And then we have objective criteria to determine if the patient's sexual function has improved and the sensation as well. Every patient is very different, so we are proud to take care of the patient needs. So if let's say a patient pays for 6 sessions and the patient is not satisfied, then we give the other sessions at no extra cost for the patient, because what is important is that the patients are satisfied. And I believe that that is a key ingredient of being for us to be successful, and we have great reviews. We're a business, but we care about patients be satisfied and get the results that they're looking for.
I know you take a very patient-centered approach when it comes to dealing with your patients, and you take a very a personal approach to when people come, and you assess exactly what their needs are and offer a really good treatment plan based on their needs. It's not just one package for everyone. You take a very patient-centered approach, and I appreciate that about you. And we get such positive feedback from all of your patients that come and work with you. So it's really great that we have that service, that you provide that service. So.
Yes, well, we do it, it's work, but it's also fun. It's also a wonderful sense of, a great sense of satisfaction when we see the patients that say, yes, I'm doing it, I'm so happy, I'm so grateful, thank you so much. So that means a lot to us.
Yes, we have your website with some of the services, the female hormone replacement therapy, cosmetic, the PRP, the vampire facelift that everyone, of course, the name vampire facelift, of course, makes everyone very inquisitive, wrinkle reduction. If there's anything in particular you want us to show, but it's...
No, I think we have, it's important to mention also, even though we cater to a gay social or a gay demographic, that we also treat menopausal women. Women is very drastic, the metabolic changes that women go through when they're menopausal, and they struggle a lot with weight reduction. So having their hormone balance and providing the right metabolic enhancement to before that metabolic age, thyroid is very important. It's very common in women struggling with weight. With severe hot flashes, with lack of libido, vaginal dryness, etc., etc. So the hormone replacement therapy is very efficient for women, and women are a little bit more challenging in certain areas because we need to balance the adrenals, we need to balance the thyroid. But I have taken my time being able to determine all the other factors that are very important in order to balance the woman's metabolism and allow them to sleep well, to lose weight, and to enjoy their sex life.
Weight loss is a very common program. I'm sure you see a lot of people coming to you for weight loss. Yes. The COVID-15, as many people have said, people have gained because of they're sitting around eating and not able to exercise. So this is a good time for people to come see you for weight loss right now, I would think.
Yes, definitely. We have a way to determine our body composition. The body mass index is still in mainstream medicine, but it's kind of an obsolete um, uh, measurement. So what we go is for the lean body mass percent, and we go for the body fat percent. And we have a way to calculate it very, very specific. And then based on that, we also can calculate the metabolic, based on metabolic rate, which means how many calories your body burns in order to sustain you alive. And then that's when we are very good advising the patients what to eat, when to eat, how many calories, the amount of protein, carbohydrates, and fats, good fats. And then the patient get active and start exercising. And it's a whole comprehensive plan. We do a third by advising the patients, restoring the hormones, and giving the right peptides. And the other two-thirds are done by the patient's exercising lifestyle and eating, nutrition.
It's time for people to get back and exercise and eat better. I've been definitely guilty these last few months of slacking off and eating and exercising, and so I probably need to make an appointment to come get back on a good exercising and eating program and stop eating so many Oreos and get back on a better eating plan. It's been easy to kind of be easy with the Burger King and everything else, and it's a lot of work. It is a work to be and be intentional about healthy eating, intentional about exercise, and intentional about keeping our bodies and minds in the best shape possible. We have to be intentional about those things, and coming to see someone like you who can put them on a good treatment plan and give them some good medical solid advice is really needed more so now, I think, ever than before, because people have really been, I think, closed in. I've heard a lot of people who have just really shut down. And so if you can give them, some really good plan to get people back on track, this is really the time for people to come and see you even more so.
Absolutely. Well, the COVID is a good call to action. One of the reasons why we see such a high level of death rates in this country is because for years and years and years, we as Americans have forgotten how important nutrition is. We have recourse to the fast food. We have been eating a lot of processed food, and obesity in this country is, extraordinary compared to the European countries. So COVID, in essence, has been is sad, but it has given us to stop, to pause, to think, to reassess our values, to reassess who we are as an individual, and to recognize that our actions affect others, and the way that we as individuals can impact others is that's why we are in this situation. And then life always find a way to do things in a different way, and we are in the midst of that. Unfortunately, there's a lot of people that are dying, people with financial uncertainties, but that's part of what is called us to as Americans to get together and come up with a plan, but we need to recognize the fact that our nutrition is lacking and our society is, and that's why the mortality is so high in this time. So my hope is for everybody when this pandemic is controlled to take care of themselves. We are responsible of each one of us. And this is something that is all of us can help in doing that. When somebody comes here, stress also is a big factor. It will decrease your immune system. So for me, when the patient come here, I just see the need. I see me rather than being regimented and being kind of a drill sergeant. I use a supportive approach. I just do recommendations. And because I have to be cognizant that we are in a pandemic and these are extraordinary circumstances, when stressed, and actually going to meditation, using calming herbs, getting acquainted with loved ones and family is one of the best medicines that I can prescribe to anybody at this time.
That's great. Well, I know everyone that comes to you comes back with really a positive experience, and I actually know people who are on the IV hormones and all that, and they look forward to their appointments because they know they're going to feel better when they come back to see you. So everyone, yes, it's very good. So
I cannot do that without my team. All our employees are wonderful. They strive to make everybody feel at home and address their needs. They're good listeners, and I wouldn't be able to do all what I do without having them assisting me. Also, my husband is my right or left hand. I don't know which one it is. I think the left one, but it's a group effort that we here recognize, and then we provide that to the community and everybody that is coming to look for our services.
Well, that's great. We really appreciate the work and the patient-centered medicine that you provide to your patients. One of the final questions I ask people is what words of encouragement do you have for people during this very difficult time?
Yes, I think that it's important to give and just look around and recognize what other needs people might have. I think there's can be stressful situations, but with be loving and kind to one another, and just recognize that we are all in this together, that we are going to be okay. That's not to lose the hope. And if you need help, reach out. There will be somebody there that will be able to help you in one way or the other. And take care of yourself in the best way possible. Avoid the stress, eat and sleep. That's the best advice that I can give anybody. It seems that we're about to become public the use of the first vaccine. That's still to come. But in the meantime, do social distancing, wear your mask, be responsible of your life, because maybe you don't suffer from COVID, but you transmit it to somebody else. That can be the grandmother, the mother, or the father of somebody. So that's our responsibility.
I like your advice. It's a balance of A, give and reach out to others, and B, take care of yourself. Which it's a hard balance to do both, but it's important to do both. I think that's a really good word. Is there anything we didn't cover that you would like to cover?
No, not at all. I think our conversation was extensive. I think that I will encourage anybody that has any questions to reach out. Go to our website, www.dhinstitute.com. We also are in Facebook, Instagram, LinkedIn, and our phone number is on the internet. If somebody any questions, they can give us a call, make an appointment for a free consultation, and then we will be able to answer those questions more specifically.
Okay. Arthur, who helps me across the desk, we've got your website up there on the page, your Facebook, and your phone number. So you're right here in Wilton Manors, very close to 5 Points. You have a very beautiful office. It is really very nice, very welcoming. All of your staff are very welcoming, and we're glad that you're part of the magazine and part of our community. So thank you for working with us.
Thank you.
Our website is Outclick, OUTCLIQUE.com, or you can text OCQ to 22828 to get more information on us. So thank you for chatting with us today. You have a lot of really great services, and I know people are very pleased with what you do for them.
Okay, thank you, Stephen. Thank you, Arthur, and always a pleasure to work with you.
Thank you. We will chat again. Thank you.
Okay, take care. Bye-bye.